The scan is ready. The AI read it before the sonographer moved the probe. Medical sonographers spend years mastering the art of ultrasound, guiding transducers with precision, interpreting the shapes, shadows, and flows that reveal what is happening inside the human body. But artificial intelligence is now analyzing ultrasound images in real time, flagging anomalies, measuring fetal development, and detecting cardiac abnormalities, sometimes with greater consistency than the human eye. So, is medical sonography on borrowed time? And what does this mean for the sonographer standing at the bedside today? Let us start with what AI is already doing in the world of medical ultrasound. AI-powered ultrasound analysis platforms are already interpreting echocardiograms, measuring ejection fractions, and detecting structural heart defects in real time. Tools like Caption AI and EchoGo are being deployed in hospitals across the United Kingdom and the United States, identifying findings that might otherwise be missed on a busy scan list. Machine learning algorithms are analyzing obstetric ultrasound images to measure fetal biometry, head circumference, femur length, abdominal circumference, with accuracy that matches or exceeds experienced sonographers. These tools are reducing scan time and flagging growth restriction earlier than traditional review. AI diagnostic tools are detecting liver disease, thyroid nodules, and breast lesions in ultrasound images, automatically flagging suspicious findings and generating structured reports, work that currently requires trained sonographers reviewing hundreds of images per day. Automated ultrasound guidance systems are beginning to assist in vascular access, nerve blocks, and biopsy guidance, reducing operator dependency and improving needle placement accuracy in procedures. AI triage tools are prioritizing urgent findings such as free fluid in trauma patients, deep vein thrombosis, or placental abnormalities, and routing them immediately for clinical review, compressing response times that once depended on human turnaround. And handheld AI-assisted ultrasound devices like Butterfly IQ are enabling non-specialists to perform point-of-care scans with AI interpretation, extending ultrasound to settings where no sonographer is available. But here is where the medical sonographer remains absolutely irreplaceable. Sonography is a uniquely hands-on, patient-facing skill. It requires real-time clinical reasoning, adjusting probe position, pressure, and angle based on patient anatomy, breathing, and discomfort. No AI can yet replicate the tactile intelligence of a skilled sonographer adapting mid-scan to a challenging patient. Complex and high-acuity examinations, fetal anomaly scans, detailed echocardiography, intraoperative ultrasound, musculoskeletal assessment, and interventional procedures demand expert human judgment, anatomical knowledge, and the ability to interrogate unexpected findings dynamically. Patient experience is central to sonography. Pregnant patients receiving fetal anomaly scans, patients receiving cancer diagnoses, and critically ill patients undergoing emergency imaging need a human presence, someone who can explain, reassure, and respond with empathy. That is irreplaceable. Advanced practice sonography, where sonographers report their own findings, lead specialist services, and operate as the primary diagnostician, is growing rapidly. Sonographers who move into clinical reporting, leadership, and AI system oversight will be at the highest level of the profession. And sonographers who become expert operators of AI-assisted platforms, understanding their limitations, validating their outputs, and integrating AI findings into clinical pathways, will be indispensable in the modern imaging department. So, will medical sonographers be obsolete by 2030? The reality is this: routine, protocol-driven scanning, standard obstetric biometry, basic cardiac screening, thyroid surveillance will increasingly be assisted and partially automated by AI. This will compress demand for purely task-based sonography roles. However, the demand for advanced, specialist, and interventional sonography is growing significantly, driven by aging populations, the global expansion of point-of-care ultrasound, the growth of musculoskeletal and vascular imaging, and the increasing complexity of oncology surveillance. The Society of Radiographers projects that while AI will automate a substantial proportion of image analysis tasks by 2030, the clinical shortage of qualified sonographers across the NHS and globally means that human expertise will remain in high demand for at least a decade. Medical sonographers who develop expertise in fetal medicine, echocardiography reporting, interventional procedures, advanced vascular imaging, and AI system governance will be among the most sought-after clinical professionals in diagnostic imaging by 2030. The sonographers most at risk are those performing purely repetitive, protocol-bound scans without advancing their clinical reasoning, reporting skills, or specialist expertise. By 2030, the scanning room will be shared between human and machine. AI will handle the measurements and the alerts. The sonographer will handle the complexity, the compassion, and the clinical decisions. AI is not replacing the medical sonographer. It is placing the most powerful diagnostic tool ever built in their hands. The future of ultrasound is not the probe or the algorithm. It is the expert who knows how to use both.